So let us talk about hiatal hernia. By hiatal we mean a defect. By hernia we mean any abnormal protrusion of a cavity's content through a weakness in the wall of that cavity along with the lining of that cavity. Hiatal hernia is a defect in the diaphragm because of weakening of the phrenicoesophageal ligament so that the gastroesophageal junction cannot be kept in its normal position. Talking about the types, the type 1 is sliding hiatal hernia, type 2 is para-esophageal hernia, type 3 is mixture of 1 and 2, number 4 if the defect is quite large enough that it allows stomach and even intestine to enter into the thorax. Now how they will present. The first type, the sliding hiatal hernia, can either be totally asymptomatic and requiring no treatment, or it can present in the form of heartburn or regurgitation, as we have learned before that hiatal hernia, specifically the sliding type, is one of the etiology for causing GERD. So all the treatment guidelines for GERD will be followed. Talking about the second type, the para-esophageal hernia, it will present with dysphagia and post-prandial fullness. Number 3, the mixed type will present with respiratory symptoms, for example, dyspnea, aspiration pneumonia. The fourth type will present with ulceration of the herniated stomach. It can develop into a volvulus which can bleed, it can perforate, it can cause ischemia of the part which is involved in that volvulus. Now once we are suspecting any patient to have hiatal hernia, we will perform an X-ray and it will give us information about the air fluid level in the posterior mediastinum. Now once we have seen an air fluid level in the posterior mediastinum on an X-ray, we will ask for barium swallow. Barium swallow is the investigation of choice for diagnosing hiatal hernia, and then we can also perform endoscopy to quantify or evaluate the patient. Now once diagnosis of either the second or the third or the fourth type has been made, we have one option, operative repair either through thoracic or abdominal approach. Now as you could see on the right side, there is esophagus, stomach. The esophagus is passing through the diaphragm, that is known as hiatus, that is a defect in the diaphragm, and there is present phrenicoesophageal ligament. Now this ligament not only holds the esophagus, but it also provides prevention of food from the stomach into the esophagus. As you can see on the left hand side, there is written type 1. Now type 1 hiatal hernia is the sliding type. In this type, gastroesophageal junction passes through the hiatus of the diaphragm and it enters into the thorax because of weakening of the phrenicoesophageal ligament. In the second type, the gastroesophageal junction remains at its place and a part of stomach enters into the thorax through a defect, and it is called as para-esophageal hiatal hernia. Now this patient is very less likely to develop GERD, but he or she may develop dysphagia and other problems. Talking about the third type, in this both gastroesophageal junction along with that a big part of stomach has also entered into the thorax. Now this patient will have compressive symptoms. Talking about the fourth type, you could see not only the gastroesophageal junction and a big part of stomach, but also small intestine has entered into the thorax, which caused severe problem to the patient, and there is only one option, operative repair.